Before preparing the insulin pen, begin by applying hand sanitizer and cleaning your hands thoroughly. Proper hand hygiene is an important step before handling any injection device. Next, take the insulin pen and remove the cap. Using an alcohol wipe, carefully clean the rubber tip of the pen. Allow it to dry for a few seconds before proceeding. Now gently shake or roll the insulin pen 8 to 10 times to ensure the insulin is mixed properly. This step is especially important for insulin types that require mixing before use. Always check that the insulin appears normal according to the manufacturer's instructions. After that, attach a new pen needle securely to the insulin pen. Once the needle is attached, remove the outer cap and then the inner protective cap. The next step is priming the pen. Hold the pen with the needle pointing upward and gently tap the cartridge to move any air bubbles to the top. Select a small test dose and press the injection button until insulin drops appear at the needle tip. Seeing a drop of insulin confirms that the pen is functioning correctly and ready for accurate dose delivery. Finally, rotate the dose selector and set the prescribed insulin dose.